The calves are made up of two main flexor muscles, the gastrocnemius and the underlying soleus muscle. The deep compartment of the leg seems to be more geared towards stability than movement. The gastrocnemius is the only calf muscle that crosses two separate joints, the ankle and the knee. As a result, it absorbs considerable force. Research reports that tightness in the gastrocnemius can increase rates of foot injury of all types. Dorsiflexion is the upward bending of the ankle, what your ankle does at the bottom of a squat. It's also how your foot clears the ground while walking and running. This movement is essential for uncompensated movement of the lower extremity. Just for normal walking, the ankle should dorsiflex at least 10 degrees. For running, dorsiflexion should equal closer to 25 degrees. Squatting has been shown to require an average of 39 degrees of ankle dorsiflexion, just to keep the heels down through the movement. You can check your own ankle dorsiflexion angle by simply getting on one knee and shifting your weight all the way forward. Measure the angle of the leg that's forward between the tibia and the foot as best as you can. Acquiring good ankle dorsiflexion will make the bottom of your squat deeper and more comfortable. Trigger points in the gastrocnemius will often present in the medial calf and travel into the inside of the arch, as you see in blue. Those in the soleus will contribute to heel cord pain, as you can see in green. However, the pain could be anywhere. Mobilize where you feel the adhesion. The calf muscles are easy to feel yourself. Sit comfortably where you have access to your legs and search for any areas of soft tissue change. Our functional test will feature an air squat as low as you can go. Pay attention to where your weight shifts in your feet and your body position. A positive test will feature heels coming off the ground or an inability to squat below parallel. Other signs of ankle immobility may be knees rocking inwards or the chest tipping forwards. Also, if you feel an adhesion with your hands, this is always a sure sign that you need to treat your calves. First, we'll use a pin and stretch technique where you shorten the muscle, contact the muscle in the area of the adhesion, and then lengthen. Let's check it out. Sit on a bench so you have access to your leg. Use your fingers to search for that tight or tender tissue. Point the toes down and push on the adhesion you found with the double thumb contact, wrapping the fingers around the shin and squeezing with all 5 fingers to create the pressure. Now dorsiflex the foot upwards while holding the contact firmly into the adhesion. Repeat until the adhesion softens. Do you think that the problem is deeper, like the toe flexors or the posterior tibialis? Do you have foot pain or plantar fasciitis? An incredible wealth of knowledge exists about how to treat these individual structures and stop your pain. Simply search for an ART provider who is certified to treat the lower extremity. Go to activerelease.com and click Search for a Provider. I recommend that clients try their hand using mobilization tools. The idea is simple: fascial manipulation from the surface of the skin. The tool doesn't have to be expensive, and for this you could even use a metal utensil like the dull part of a butter knife. But for this, we'll be using a tool from adhesionbreakers.com. It's got this nice beveled edge on top that slides right along the surface to break up adhesions. Once again, you should begin by feeling around for tightness or tenderness. Grab the tool and lightly scrape the surface of the skin at an angle of 45 degrees or less. More than this can be too invasive and damage structures underneath. Try to find the places where the skin feels stuck. You might feel like there are bumps under the tools as you lightly scrape, and it should be your intention to try to break these up. Lotion is not essential, though it can ease the treatment. Focus on the areas that turn red as you run the tool over them after the first few initial passes. Don't destroy the tissue, just help the tissue slide and become supple again. Treatment here should be less than 2 minutes. Now we're going to try using voodoo floss bands to mobilize the calves. The bands will create compression to push out swelling. Movement with the band wrapped around the limb will shear across tight fascial structures, breaking down their stickiness and restoring sliding surfaces, all while reducing inflammation. Voodoo Floss is a terrific tool to get the knots or tissue swelling quickly out of the arms or the legs. This treatment will focus on the Achilles area. Let's check it out. You should begin by feeling your calves to get a sense of where your target area will be. Grab the Voodoo Floss and start wrapping a few inches above your target area. Overlap half the width of the band with each pass. Use as much tension as you can stand, wrapping about 75% full stretch on the calf side and 50% on the other side of the leg at the shin. If you have excess while wrapping, wrap an X across the target area you want to mobilize most. Tuck the tail in under a tight piece of band to finish. For safety reasons, don't keep the floss on for periods longer than 4 minutes. You can make sure that the foot has adequate blood supply by squeezing a toe and making sure that a little bit of color returns when released. Don't keep the banding wrapped tight for longer than 4 minutes. The goal with any flossing is to restore movement by moving the tissue under the floss, especially into restricted positions. Mobilize in the Achilles by doing several deep squats. Hold the squat at depth and try to stretch the ankle where you feel it restricted. You could also get in a lunge position with the treatment leg forward. Pump the lunge forward as you push with your thumbs to shear the tissue under the band, laterally for a few reps and then medially for a few. To Voodoo Floss the calf muscles higher where the meat of the muscle is, wrap it higher and try doing heel raises and pumping calf stretches with your knee straight and then bent, all while wearing the floss wrapped higher on that calf muscle. Think about what the floss is doing here. It's creating a web of compression over the adhesion, then forcing fluid out and forcing fibers to slide on one another. This simple concept fixes a lot of problems at once. I encourage you to try Voodoo Flossing higher on your quads or even in your arms as well, which we'll visit later in the overhead pressing module. To stretch the gastrocnemius muscle on the outer calf, find a sturdy object that you can lean onto, like a wall. Keep your knees straight as you shift your weight and hip forward over the ankle. Hold for at least 90 seconds. This works great for the outer portions of the calf. To stretch the deeper muscles like the soleus muscle and the deep flexors, move the leg you are treating a little closer underneath your body. Now simply bend that knee and drop into the stretch. Hold for at least 90 seconds. Static stretches are the least specific way to get an adhesion out of a muscle, but they're great if you only have a few minutes. Remember that you'll need to stretch with the knee straight for the gastrocs and bent for the deeper soleus muscle in the Achilles tendon. Keeping a mobile ankle is one of the simplest things that you can do to prevent knee pain and degeneration. This move uses a mobility band to deeply stretch those tight pieces of the ankle. Let's check it out. Place a plyometric box about 30 inches tall, about 4 or 5 feet away from an upright. Connect a medium band to that upright and position the band in front of the ankle joint. Now step that foot up onto the box. Put all your weight down through the knee and into the ankle. Use your hands to move the knee around and position the knee where the ankle feels restricted. As with any capsular move, you must hold at least 2 minutes for the desired effect. Hey, it's me, Dr. Nick, and I wanted to give you a head start in getting these tools for your calves. One of my favorite tools in practice is the VersaTool, which features a double beveled edge, making it impossible for you to use incorrectly. Also, grabbing a black mobility band for ankle mobilizations is something that can create dramatic improvements in your ankle range of motion. But it's really purchasing the Voodoo Floss that will be a magical addition to your gym bag, since it very quickly pushes knots out of either the calves, the quads, or the arms. So shop now at MobilityWODShop.com and grab these epic tools today.